Have you ever experienced a burning and sore sensation in the mouth or itching sensation around the vaginal and vulvar area? Candidiasis is an infection caused by a yeast, a type of fungus called candida. Candida normally lives inside the body, in places such as the mouth, throat, gut, and vagina, and on skin without causing any problems. Sometimes candida can multiply and cause an infection if the environment inside the vagina changes in a way that encourages its growth. Hello everyone, I'm Ume from CloudHospital TV, and in the next minutes I'm going to talk to you about yeast infection. And before we start, please subscribe to our channel so the next time you'll be updated with our new releases. So let's start with what exactly is yeast infection? Candidiasis. Yeast infection can also be referred to as candidiasis. It is a widespread infection that occurs due to Candida albicans yeast, a form of fungus. Normally, Candida does not usually cause any problems and it is supposed to live inside the body. Yeast infections are common in the warm and moist areas of the body, including the mouth, gut, vagina, throat, and the wet parts of the skin. Thrush is the name of a kind of candidiasis that affects the mouth. In immunocompromised people, candidiasis is more frequent as a secondary infection. Now let's talk about how does yeast infection occur. Typically, yeast infections are not a sexually transmitted disease. They are not infectious and cannot be transferred from one person to another during intercourse. A yeast infection can occur due to something that disrupts the natural balance between the yeast and bacteria in the vagina. Antibiotics used to treat a dangerous bacterial infection, for example, can also destroy Lactobacillus, a bacteria. This is a good bacterium found in vagina that maintains yeast at bay. Now let's talk about some examples of diseases caused by Candida. Thrush is an infection that occurs if Candida yeast spreads in the throat and mouth. It is more frequent among the elderly, newborns, and those without compromised immune systems. You may experience one or more of the following signs and symptoms: white or yellow bumps around the inner tongue, cheeks, lips, tonsils, or gums, burnings and sore sensations in the mouth, cotton-like feeling in the mouth, cracked and dry skin around corners of the mouth. Second one is the genital yeast infection or genital candidiasis. Approximately 3 out of every 4 adult females will develop a yeast infection at any point of their lives. The infection may sometimes be spread from one person to another during intercourse. Also, genital yeast infections may occur in men as well, but they are much less frequent. A vaginal or genital yeast infection may be associated with multiple signs and symptoms such as itching sensation around the vaginal and vulvar area, thick and white cottage cheese vaginal discharge, swelling and reddening of the vulva and vagina, small cracks and tiny cuts in the skin around the vulva, and painful intercourse. Now 3. Diaper rash. Diaper rashes typically occur due to leaving a damp or soiled diaper on the baby for an extended period. When the child's skin gets irritated, infection becomes more probable. In case the diaper rash persists, examine their bum and check if it is sensitive and red. Also, see if there is an elevated red border on the sores. In this case, have the doctor test for candidiasis. So how is yeast infection diagnosed? To effectively diagnose a yeast infection, the following may be required to reach appropriate diagnosis: medical history about previous yeast or sexual transmitted infections, performing a pelvic examinations to assess the external genital areas for any yeast infection signs, testing the vaginal secretion. If necessary, the doctor can obtain a sample of the vaginal secretion fluid to analyze the fungus types. Determining the types of fungus enables the physician to prescribe appropriate treatment forms for recurring yeast infections. Now finally, what is yeast infections treatment? Yeast infection treatment usually depends on the type and nature of the infection, whether it's complex or not complicated. Yeast infections can be easily treated with ointment or other anti-yeast creams. Creams or medical treatments can be used to treat vaginal or penile yeast infections. An anti-yeast drug taken orally is sometimes utilized. A medicinal mouthwash can be used to treat a yeast infection in the mouth. Lozenges that dissolve in the mouth can also be used to treat it. If you have a serious illness and a weakened immune system, you may need to take an anti-yeast medication orally. Anti-yeast medications, either oral or intravenous, are typically used to treat esophageal yeast infections. Anti-yeast powders can be used to treat yeast infections in the skin folds. Thank you for joining us in yet another video covering key health-related topics with CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible. So just sit down.